We have to distinguish between snoring and sleep apnea. Snoring is a social problem, but sleep apnea may have side effects having consequences on the person's health over a long time. Someone with sleep apnea may have more tendencies over cardiovascular disease. So it's very important to assess to what degree sleep apnea may be and to propose or to suggest a proper treatment. The treatment is not surgically oriented like snoring may be. The best treatment for sleep apnea is a CPAP. So it's a small machine that keeps the airways open while the person sleeps, preventing collapses. Sleep apnea symptoms are sleepiness, fatigue, frequent headaches, mostly in the morning, and this may have some effects on the quality of life. It may affect the productivity of this person, and over a long period, it may enhance the risk of cardiovascular disease. So it's very important to assess the problem as soon as possible and to propose a treatment to correct these symptoms and to prevent long-time side effects. Surgery is not the first option. The best treatment for sleep apnea is the use of a CPAP, this little machine. Prevent collapsing of the muscular structures in the throat and in the mouth, and it allows a better ventilation. It allows a better oxygenation of our brain during while we sleep, thus diminishing the daily symptoms. If it's not tolerable, there are other possibilities, there are other options. There is a possibility of having a mouth, some kind of a mouthpiece to improve the airways. And of course, surgery may be offered if the other treatment hasn't been accepted or successful. To assess the degree of sleep apnea, we have to make a sleeping test. This can be done at home or in a sleeping lab. It's a very simple procedure, and we use some sensors to evaluate the airways and also the breathing of the patient, and it gives us a very precious indication of what the problem is.